Good afternoon. Today we are speaking with UMHS 2016 graduate, Dr. Elizabeth Nielsen. And Dr. Nielsen, you're currently working as a pulmonary and critical care physician. And can you tell us a little bit about where you're currently working?
Yeah, I'm actually in the suburbs of Milwaukee, in Waukesha and Oconomowoc, at a health system called ProHealth. They are also partnered with a place called SCP Health, which is a nurse practitioner run ICU. So a lot of collaboration, but near the Milwaukee area.
Okay, great. And you completed, or did you just complete the Pulmonary and Critical Care Fellowship at Southern Illinois University School of Medicine? Was it last year? Can you tell us
Yeah,
a
it was
little bit about
last
that?
year. Yeah, last summer slash fall time. I took some time off to be with family.
Okay.
And then I started as a locum doctor in Illinois. Went to Decatur, Illinois, and then Bloomington, Illinois through a private locum company and did that for about 7 months. And then I started at ProHealth up here.
Okay, great. And didn't you win a teaching award during your time there?
I did. I really have a lot of passion for teaching, and which is kind of interesting because I didn't go into academics right away, but there are residents that I teach from time to time in family medicine here at ProHealth. But yeah, the teaching award was something very awesome to get at SIU. It's just that's like what I love about ICU and pulmonary. When getting to teach even the patients and their family members about what's going on with them, but as well as the learners that are on the team.
Okay, great. And you also completed your internal medicine residency at Southern Illinois University School of Medicine. What was one of the best things about that particular residency?
I think the biggest thing, I mean, when you're in medical school and at UMHS doing your rotations at different places, sometimes you can do them all in one area, but I chose to do mine in different areas. I was in different places every few months. Being at Southern Illinois was close to home, and it's pretty cool to be at a place that you know the area around there and you know where patients are coming from. You can kind of relate to them based on where they came from or where they work, or maybe the doctors in their area and stuff like that. I think the best thing about residency there is the community-based feel, even though it's an academic center. Everyone feels like a family, and I think that's probably the best part about it.
Okay, great. And getting back to UMHS, can you think about one or two things about your medical school journey studying at UMHS that helped you become the doctor that you are today?
I think one of the biggest things is being adaptable. I feel that when you go to a Caribbean medical school in St. Kitts, you already have to adapt to a new culture
Sure.
and the way of life, how life is there. And then you go to Maine, and then you go to different areas for your rotations. I think adapting to new places and health systems really makes you a well-rounded person to become the physician I have become, as well as being able to relate to the patients and their family members and different cultures and the types of people you kind of see along the way. Another thing is probably just any med school, but mostly being at UMHS. I feel like I really had the work ethic from the right at the beginning with the professors that we had on the island. In particular, I remember Dr. McCracken, Dr. Purcell in anatomy. I really loved anatomy, and those two people really had an impact on my work ethic and how to get through things when it's really hard.
Wow, they're both of those gentlemen are really great, especially Dr. Purcell. I know him very well.
Yeah.
Is there anything else that you'd like to say about current or prospective UMHS students thinking about a career in pulmonology or just medicine in general and considering UMHS?
I think the biggest thing is that no matter what your journey is, just knowing that having the work ethic and the determination to keep going is going to get you where you want to be. I think when I first started at UMHS at that time as a med student, you don't feel like you're ever going to get to that goal. It is a hard way. It's a hard way of life. It's a lot of work to become a physician, but if you keep going and you keep your support group of people that you know and your family, of course, you're not going to be with the same people all the time, but I think that that's what kind of gets you through, to like never giving up. And I know it sounds cliche, but that's kind of what makes you keep going. And I think that there's a lot of things in medicine or in just the corporate world that kind of get you bogged down at points. But I think when you have that patient that may say thank you to you, I think that's what keep those things in your head and your heart, and remember those parts and the little things that kind of get you through and keep you remembering and reminding yourself that this is why I went into medicine and this is why I want this. I think pulmonary and critical care for in that respect, I mean, I chose the medical field, like the medicine side instead of surgery, because that's just kind of who I was. I like to know a lot of details about each part of medicine. And then pulmonary critical care, my personality comes with, I love working with a team and a group of people in the ICU, and things are kind of regimented, but at the same time, you never know what's going to come in the door. Similar to ER, but ICU is my thing. And then pulmonology kind of goes along with that. Doesn't always have to, but the lungs, I will say that during at UMHS and the basic science, pulmonology was not my forte. And I never thought that that was something I was going to go into. But I think seeing my attendings in residency, in medical school, those attendings are happy with what they're doing, and it's fun to see them interacting with their patients. And I think that's a huge thing of why I went into what I did. So I would encourage people to go into it, but I'm a little biased.
Okay. Okay, great. Anything else that you want to say to alumni or prospective or current students out there?
I would say let's just keep going UMHS strong and keep talking together. I hope we can all keep like do a reunion someday. That would be pretty cool.
Yes.
But it's very cool to kind of talk to people that are in prospective students or people that are there going through each part of this journey. Don't look too far ahead. It's okay. You'll get there with the determination.